Hello, my name is Jessica Beasley, and today I'll be discussing my population health project, which focuses on addressing health disparities in African American men in the United States. I believe this topic deserves more attention, especially from a public health perspective, because the barriers these men face on a daily aren't always visible, but have long term health effects. To understand the impact, let's see how stress plays a role. Symptoms of stress are frequently ignored. Expressions of anger, violence, and overworking are misinterpreted, often criminalized rather than addressed. This misdiagnosis leads to a lack of treatment and deeper health issues down the line. Due to stigma and stereotypes, mistrust of the system, and a lack of access, Black men are less likely to receive or seek appropriate health care. It is important to raise awareness and take action since untreated mental and physical stressors lead to chronic health conditions in the future. Young African American men have strong presence in music, sports, and fashion. They are known for creativity, leadership, and shaping cultural trends worldwide. Despite having such a big impact worldwide, many live in communities with limited access to quality healthcare, education, or job opportunities. At the same time, strong values like brotherhood, mentorship, and resilience run deep. It's important we recognize both the challenges and the strengths of this population. As stated from the cited source, millions of Black Southerners relocated to U.S. cities like Chicago, Detroit, Atlanta, and Baltimore. Now let's break down some of the main health concerns. Chronic health conditions like hypertension often show up earlier in Black men than other groups. There are also higher risks of STIs, including HIV and AIDS, and unfortunately, mental health is still largely underaddressed. Many young men silently deal with depression, anxiety, or PTSD without access to proper health care or even language to express what they're going through. The health disparities we see are not accidental. They are deeply tied to things like poverty, poor quality education, and systematic racism. These are the social and structural determinants of health. When people live in unsafe neighborhoods or attend underfunded schools, it limits their ability to thrive in life. Health isn't just about biology, it is also about the environment we live in every day and how it affects our health. According to the World Health Organization, the social determinants of health are mostly responsible for health inequities, the unfair and avoidable differences in health status seen within and between countries and races. Hypertension or high blood pressure is a great example of how all this connects. It's called the silent killer because there usually aren't any clear symptoms until serious damage is done. For young Black men, the risk is higher because of things like poor sleep, chronic stress, high sodium diets, and family history. And if you can't afford or access regular checkups, it often goes undetected. According to the CDC cited source, the risk for high blood pressure can increase even more when hereditary combines with unhealthy lifestyle choices such as smoking and eating an unhealthy diet. Undetected or unmanaged hypertension can often lead to heart attacks, strokes, and kidney failure. Looking ahead, there are some positive outlooks. More conversations are happening around mental health, especially online. But at the same time, stress, chronic illness, and mental health issues are still projected to rise. Unless real changes are made, like expanding access to healthcare and investing in underserved neighborhoods and communities, the gap in health outcomes will continue to grow. According to the following cited source, while awareness about the impact stress can have on emotional and physical health seems to be present, Many Americans still continue to report symptoms of stress. So, how do we address this? Strategy to improve health in young Black men. First, we need to do culturally competent care. This means healthcare providers who understand the unique needs of young Black men, including their lived experiences. Mobile clinics and affordable services in local communities can help. We can also support mental health, creating safe spaces for open conversations, mentorships, and peer programs in familiar places like schools, barbershops, and churches. When people feel seen and heard, real healing can begin. According to the U.S. Department of Health and Human Services, one of the best ways that faith and community leaders are increasing protective factors for youth is by leveraging the power of connectedness through community to prevent and address mental health challenges in youth. In conclusion, the health of young African American men is shaped by more than personal choices. It's shaped by history, community, and opportunity. If we really want to close the gap in health outcomes, we have to listen, invest, and act with intention. A healthier future is possible, but it requires that we center community voices and build systems that work for everyone. By understanding young African American men experiences and tailoring healthcare solutions to their needs, we can close the gap in health disparities. A healthier future is possible with intentional, community led, and sustained efforts.